Want a score over 850 in your MedSurg HESI? Then let's get started. Today we'll cover 10 questions on the cardiovascular system disorders. Question 1. A client is admitted with a diagnosis of heart failure. Which assessment finding is most indicative of left-sided heart failure? Peripheral edema, jugular vein distension, crackles in the lung bases, hepatomegaly. Pause the video and select your answer. The correct answer is C, crackles in the lung bases. Left-sided heart failure often results in pulmonary congestion, leading to the accumulation of fluid in the lungs, which manifests as crackles upon auscultation. You can pause the video and go through the incorrect options. Question 2. The nurse is caring for a client with a history of AFib. Which medication would the nurse anticipate administering to help control the client's heart rate? Warfarin, digoxin, metoprolol, nitroglycerin. Pause the video and select your answer. I hope everyone chose C, metoprolol. Metoprolol is a beta blocker, commonly used to control heart rate in AFib by slowing down the heart's electrical conduction. Question 3. The nurse is assessing a client with PAD. Which finding would the nurse expect to observe in a client with severe PAD? Pallor of the affected extremity, warmth and redness of the affected extremity, absent pedal pulses, edema of the affected extremity. Pause the video and select your answer. The correct answer is A, pallor of the affected extremity. Severe PAD leads to compromised arterial blood flow to the extremities, resulting in pallor due to reduced oxygen to the tissues. Question 4. A client with hypertension is prescribed hydrochlorothiazide. Which instruction should a nurse provide to the client regarding this medication? Take this medication with food. Limit your intake of potassium-rich foods. Expect increased urination while taking this medication. Stop taking the medication if you experience dizziness. Pause the video and select your answer. The correct answer, guys, is C. Expect increased urination while taking this medication. Hydrochlorothiazide is a diuretic that increases urine output, which helps reduce blood pressure by decreasing fluid volume. Okay, everyone, we are halfway there. Question 5. The nurse is caring for a client with CAD who is experiencing chest pain. Which action should the nurse prioritize? Administering aspirin, assessing blood pressure, initiating oxygen therapy, notifying the healthcare provider. Pause the video and select your answer. If you chose A, you are correct. Administering aspirin. Aspirin is indicated in acute coronary syndrome to inhibit platelet aggregation and reduce the risk of clot formation, thereby minimizing myocardial damage. Question 6. During discharge teaching for a client with heart failure, which dietary instruction should a nurse provide to help manage fluid intake? Increase your intake of high sodium foods, limit your fluid intake to less than 1 liter per day, consume a high diet in potassium rich foods, monitor your weight daily and report sudden increases. Pause the video and select your answer. If you chose D, you are correct. Monitor your weight daily and report sudden increases. Daily weight monitoring is essential for detecting fluid retention in clients with heart failure. A sudden weight gain may indicate fluid overload. Question 7. The nurse is assessing a client with aortic stenosis. Which clinical manifestation is consistent with this condition? Pulsus paradoxus, widened pulse pressure, murmur with radiation to the carotids, hypertension in the upper extremities. Pause the video and select your answer. The correct answer is C, murmur with radiation to the carotids. Aortic stenosis is characterized by a systolic murmur that radiates to the carotids due to the turbulent blood flow through the narrowed aortic valve. Question 8. A client presents to the ER with a suspected myocardial infarction. Which laboratory test would be most indicative of myocardial damage? Troponin, creatine kinase, BNP, CRP. Pause the video and select your answer. The correct answer is A, troponin. Troponin is a cardiac biomarker released into the bloodstream following myocardial cell injury or death, making it the most specific indicator for myocardial damage. Question 9. The nurse is caring for a client with heart failure who is prescribed Lasix. Which assessment finding would require immediate intervention? Potassium level 4.0, urine output 150 ml in 8 hours, respiratory rate 24 beats breaths per minute, serum creatinine level 1.2. Pause the video and select your answer. The correct answer is B, urine output of 150 ml in 8 hours. Furosemide is a loop diuretic that promotes diuresis and increased urine output. A urine output of 150 ml in 8 hours is inadequate and may indicate renal dysfunction or inadequate response to the medication, requiring immediate intervention. Okay, we made it to question 10. A client with a history of heart failure is admitted with an acute exacerbation of symptoms. Which medication would the nurse anticipate administering to improve cardiac contractility? Enalapril, atorvastatin, dobutamine, spironolactone. Pause the video and select your answer. If you chose C, dobutamine, you are correct. Dobutamine is a positive inotrope that increases cardiac contractility and is commonly used to improve cardiac output in acute exacerbation of heart failure. Click that subscribe button and comment below and let us know what you learned today. Join us next Monday.